So there are some risks to having a baby after 35, but it's not insurmountable, and it's not anything to be fearful of. So it's just something that we all need a little bit of knowledge about. As most of you know, that our risk of infertility goes up with age. So, after 35, there's an increased risk of needing assistance to conceive. Luckily, fertility treatments have come a really long way. So if that is a need, it is certainly something that can usually be accomplished. There's increased risk of miscarriage in women over 35. And that's really more related to the egg quality rather than the ability to stay pregnant. So women that are over the age of 35 that have used donor eggs typically have a lower risk of miscarriage than women over 35 that have used their own eggs. This risk, though, is still fairly small. So it's not a huge increase. And 15% of women having babies are over the age of 35, and 10% of babies are born to women that are over 35 that are first-time mothers. So this is very, very common. Other risks that can occur is an increased risk of Down syndrome. This is a commonly used example, but again, these risks are relative. The risks at term of having a baby affected by Down syndrome at 35 is around 1 in 350, and by 45 years of age, the risk of having a baby at term with Down syndrome is around 1 in 35, compared to around 1 in 930 women at age 30. So the risk does slightly increase, but again, is not a gigantic increase. Other risks that you will see in the literature about advanced maternal age can include the risk of stillbirth. And there's a higher rate in stillbirth in women over 35 having their first baby compared to women over 35 that are having second or third babies. The rates of stillbirth can increase from under the age of 35 of about 0.37% or 3.72 per thousand to around 8% of women over 40. So because of these risks, we can offer some extra testing to give extra reassurance for women giving birth over 35 so that we can keep, kind of closer tabs on baby. And, in terms of why there's an increased risk of stillbirth, we don't know completely. There's ideas out there that it's related to, uteroplacental insufficiency, meaning that the placenta just doesn't work as well because of aging vessels in the uterus. But we don't know that because there's not an increase in risk of other things that can happen with that insufficiency, things like growth restriction. The risk of growth restriction doesn't go up with age, and you would think it would if it was purely a placental issue. So we don't really know. So because of that, we do offer extra testing. Other things, and I'll get to the extra testing in a minute. I'm holding that out there for a minute. Other risks that can happen after 35, there's an increased risk of gestational diabetes and of hypertension. We don't know a great reason why that happens, except that as we age, we all become more at risk of developing hypertension and diabetes. Sometimes it's sitting at a desk, for too long, and sometimes we gain weight and makes us a little more prone to diabetes or high blood pressure, even coming into pregnancy. So we know that we see increased rates of that during pregnancy in women that are of advanced maternal age. So sometimes we'll see those increases, but it's likely just due to increased risk for that as we age anyway. There's increased risk of cesarean birth as well, but interesting piece on that is a lot of the increased risk of C-section is due to elective sections. In women that are 18 to 34 years old, there's a very low use of elective C-sections, around 4%. But in women that are 40 to 45 years old or 40 plus, that goes up to 12.5%. And that's probably due to just convenience factors and wanting to plan. With age, those risks can increase. But I don't want it to sound like everything related to having a baby over 35 is a negative thing, because women over 35 have the highest rates of breastfeeding. There's huge social benefits to having a baby over 35, because most of the time, women over 35 are a little more settled, typically have a job that will work with them, that has better benefits or has, more leave. There's a lot of benefits to having a baby over 35 when we're a little more settled in life. So that's something to be said. And since really 35 is the new 25. It is becoming much more common because of that. So things that you could expect. I told you I was going to tell you about the testing. This is kind of the things that you can expect. All women that are pregnant should be offered genetic testing. That goes across the board, but all women over 35 in particular are offered that genetic testing. And then women that are of advanced maternal age may also be offered some extra testing options, just to give us some reassurance about the baby. So women aged 35 to 39 or so are offered, or often encouraged, not everyone, but often encouraged to take a baby aspirin after the first trimester. They're often offered weekly testing, meaning at around 36 weeks, your provider might recommend that you start having what's called a BPP. That's a biophysical profile. It's an ultrasound that looks at baby's movement, breathing, tone, level of fluid. They might recommend that every week, or they might recommend what's called a non-stress test, which is where we monitor baby's heart rate for a set amount of time and look for some features that give us some reassurance that baby's doing okay and is oxygenated. So your provider may discuss those things with you. Sometimes when women are over 40, we might also recommend a growth ultrasound in the third trimester around 30 or 32 weeks, just to check on baby. Again, that's back to what I was discussing about the placenta and that there might be a little insufficiency there. So we might check on the growth. So your provider will work with you to come up with a plan that works for you, and it helps to encourage the safest pregnancy and safest birth for you possible. And we don't think there's really anything magical about the age 35. We think that risk of complications kind of gradually increases throughout the childbearing years. That the 35 is not a magic number. That's just kind of what we use for parameters, because we'll use the 35 to 39 and then the 40 to 45 and 45 and up. But we think that risk just kind of gradually increases over time. So things that you can do if you're planning to have a baby after the age of 35 are common sense things, like coming into pregnancy as healthy as you can be. So maintaining a healthy weight, maintaining adequate activity levels. And, I know during COVID in particular, it's been very hard to get enough activity. And, many of us are sitting on Zoom and sitting in front of a computer more than we ever have. So sometimes we have to put a lot of effort into getting that physical activity and to keep that healthy weight. If you have diabetes or you have high blood pressure, keeping those under tight control so that you're as healthy as you can be entering into pregnancy. So I always recommend a preconception visit with your provider, be that your midwife, your OBGYN, your nurse practitioner, but having a preconception visit so that you can discuss anything that needs more attention or tighter control, if you will, before you become pregnant. That's generally, recommended across the board. And then continuing a prenatal vitamin. In some women that are over 35, we might recommend a little higher dose of folic acid. For most women, though, we just use a regular prenatal vitamin. And then focusing on diet and making sure that you're eating a good balanced diet with fruits and vegetables, all the things you want to do to stay healthy and enter pregnancy as healthy as you possibly can. So pregnancy over 35 is very common. It is not something to be scared of. It is just something that you need to know about and know what you would like to talk to your provider about in terms of keeping yourself and your baby as healthy as you possibly can. Just a little, little blurb, shameless blurb about midwives. We have very good outcomes. We take care of women that are over 35, and often in consultation with our physician partners. But we have great maternal outcomes and baby outcomes with women over 35 every day. Before I came into this kind of little talk, I quickly looked up kind of the rates around the world of the oldest women to give birth. And there was a 74-year-old woman that gave birth in India to twins. She did have in vitro fertilization with an egg donation, but she gave birth to healthy twins at 74. And in the U.S., and a few years ago in New York, there was a 57-year-old woman that gave birth safely, healthy newborn. So advanced maternal age, although the phrase and the name of it is a little off-putting, it's safe, it's just fine. It's just something to be aware of and to kind of know what your needs are going to be, and to prepare for as much as you can beforehand. So,
all right, I think you're about running out of steam. Man, that was fantastic. Okay, tell people your name once again, and so they know.
Davis.
Melissa Davis. Thank you to Melissa Davis for presenting that. That's been very helpful, and I do appreciate, you said it was a shameless blurb, but actually that's helpful information. That's exactly what we need to know so we can find out more and so people can get more info. Thank you for what you do.
And thank you for having me today.